Hello, my name is Suzanne Foley, and I am the current director of the Early Hearing Detection and Intervention Program. I'm commonly referred to as EHDI at the Indiana Department of Health. Thank you for coming to listen to our update that is at the 2021 ISHA convention. The EHDI program is housed at the Indiana Department of Health under the Maternal and Child Health Programs. We also collaborate and work within the Genomics Newborn Screening Team. Every state has an EHDI program determined by federal law that is responsible for monitoring the newborn hearing screening program in the state and is responsible for following up on all babies that do not pass their hearing screen to ensure that they receive diagnostic testing, audiology testing, to either confirm normal hearing or be identified as deaf and hard of hearing. Our staff is made up of myself, the director, Stacy Allgaier, our follow-up coordinator. We have two parent consultants, Julie Swaim and Lisa Wolf, who are responsible for contacting every family with a baby who does not pass newborn hearing screen. We have 6 regional audiologists around the state that provide on-site training to hospitals and healthcare providers. We also have a parent-to-parent support programs. One is called Guide by Your Side, and Astra, which provides free parent-to-parent support if a family has a child that is identified as deaf and hard of hearing. Those services are available for families up to 1 year at no charge after diagnosis. So national and state EHDI goals are commonly referred to as 136, which means that all babies born in Indiana should receive a hearing screening by 1 month of age. If they do not pass that hearing screening, they should receive a diagnostic audiology evaluation by 3 months of age. And then if they are identified as deaf and hard of hearing, they should be enrolled in early intervention, which in Indiana is our first step system, by 6 months of age. So our program support is based on follow-up after newborn hearing screen all the way through diagnostic testing and identification. We also monitor and provide guidance for children who may pass the initial hearing screening but have risk factors in place for progressive hearing loss. Why is newborn hearing screening so important? And it's because congenital hearing loss is considered a neurological developmental emergency, meaning we have to provide language input to children as soon as possible for them to continue on with normal educational and communication development. There is a lot of evidence-based research showing that early intervention and identification is critical for deaf and hard of hearing children, which also led to the development of EHDI goals of 136. So 20 years ago or so, there was no newborn hearing screening mandate, and the average age of diagnosis for congenital hearing loss was 36 months or 3 years of age. And knowing what we do about the critical language development timeframe from 0 to 3 years of age, that resulted in children who were identified as deaf and hard of hearing becoming developmentally delayed. In 2018, the age of diagnosis is now 3 months, and that is consistent through 2020, and that is because of newborn hearing screening and follow-up. So efforts from speech and hearing clinicians is critical in this process in order to maximize the outcome for deaf and hard of hearing children. Our program is responsible for providing state-level data to the CDC annually on newborn hearing screening procedures and diagnosis of deaf and hard of hearing children. So we have provided some slides to show the outcomes of these efforts, and just for comparison, we compared a 3-year column for 2017, 18, and 19. So as you can see, we do a good job in Indiana of screening all the babies that we need to. In fact, the recommendation or requirement from the CDC is that 96% of all babies would receive a newborn hearing screening by 1 month of age, and we meet and exceed that in Indiana every year. There is also a refer rate, which is the total did not pass, that we monitor, and that should be around 4%. And so we hover around that number consistently in Indiana as well. So for the children that did not pass their newborn hearing screen, for example, in 2019, we had 35 189 children who did not pass their newborn hearing screening. 73% of them were identified as normal hearing, and 5% were diagnosed as deaf and hard of hearing. We also have several categories of families that refuse or decline services, that we are lost to follow-up, which means that we either send letters and make phone calls with no response or return mail, or we do reach families and they're unresponsive or do not attend or receive the diagnostic hearing testing. That 9% of children who are unresponsive, it does not necessarily mean that the child didn't receive diagnostic hearing test, but it was not reported to EHDI. Last year, or in 2019, we identified 165 children, and our goal is to identify them as deaf and hard of hearing by 6 months of age, and we have improved in that. We have also improved our efforts to enroll deaf and hard of hearing children in early intervention by 6 months of age. You can see in 19, that was 72%. That is due to a collaboration with the Center for Deaf and Hard of Hearing Education and other agencies. And then we did also increase our parent support to those families. Our numbers for the type and degree of hearing loss in the state of Indiana has been very consistent over the years. 60% of our children have bilateral hearing loss, between 36 and 43% have unilateral, and then the types of sensorineural conductive neuropathy have been very consistent. We have also been monitoring our late identifications, meaning children that were identified after the newborn hearing screening procedures. And you can see we are doing a better job of capturing that information from audiologists and healthcare providers. Again, the purpose of identifying those children and reporting to EHDI is so that we can enroll them in appropriate services or help refer them and provide parent support for any new identifications. We did have some targeted areas of underserved families that we have worked on in the last few years. We have a Hispanic parent guide, Mariana Barquette, who has been with us since 2015, and we have improved the ability or the number of Hispanic deaf and hard of hearing children who are enrolled in early intervention based on her efforts. And I also want to say that Mariana this year at the National EHDI Conference won a national award for family leadership, and we were very proud of her for that. In the coming year, we are targeting our follow-up efforts to reduce the loss to follow-up for children. These are children that are not don't receive diagnostic testing. And so we have identified through several collaborations that and our data surveillance that the families and children that are at most risk for hearing loss and for being lost to follow-up include African American children, children of single mothers, children with mothers less than 25 years of age, and children in specific counties in Indiana. So our efforts will be targeted to those populations as well. We are continuing to monitor and document the impact of COVID-19 on EHDI procedures. We did have many children who were born in Indiana during the COVID pandemic and did not receive diagnostic follow-up. And so our loss to follow-up numbers we know will be increased, and we are trying to educate healthcare providers and audiologists to make sure we are testing those children at any point in the process to make sure we're not missing children. We have done lots of updates to our EARS data collection system and reporting to obtain better data surveillance on conditions such as atresia and microtia. Foster children, we have updated our letters and resources that we send to families. We are now including developmental milestones and frequently asked questions to families in their letters to hopefully increase their compliance with the 3-month diagnostic testing. We are also distributing our pediatric audiology best practice document this year with targeted trainings to pediatric audiologists and pediatricians to improve services for deaf and hard of hearing children. The 2 parent-to-parent support programs, which are free to families of children who have deaf and hard of hearing children, is the Guide by Your Side program, which is provided immediately after diagnosis. And we assign a parent guide to that family who can offer emotional and ongoing support to help families enroll in early intervention, make sure they know what services are available, and provide guidance and support during that process. We also have a new program called the ASTER program, which is available to parents as they transition out of First Steps and into the school system, to help them with advocacy, to ask what rights they have, what services their deaf and hard of hearing children should ask for in the school system, and help advocate for those parents in that process. Our website, www.hearing.in.gov, has many resources that you can access, and our staff is listed here. If you have any questions, or we can provide any resource regarding newborn hearing screening, deaf and hard of hearing children, or services available in Indiana. Thank you.